Let's discuss face reading, tinnitus. Tinnitus refers to sound perception without any external stimuli. It is often a precursor to deafness and is caused by an auditory dysfunction. The clinical manifestation of tinnitus are diverse. Tinnitus can happen in one ear or both ears, or it can occur in the head. The ringing can exist continuously or intermittently in a variety of sound forms and varying pitches. Tinnitus can result from diseases of the auditory system, such as otitis media and otosclerosis. It can also be the result of systemic diseases, such as hypertension and arteriosclerosis. Face reading: if a crest running diagonally upward in the earlobe appears, or if the crest is above the earlobe, it is an indication of tinnitus. A crest running, so here the illustration, a crest running diagonally upward in the earlobe. Therapeutic methods. People experiencing tinnitus often should take care of themselves on a daily basis. They should avoid loud noises, maintain a quiet living environment, and not use headphones to listen to music or for watching videos for a long time at a high volume. Massage. Every night before going to bed, massage the Yemen point for 3 to 5 minutes with the fingers of your choice, which can relieve symptoms such as headache, red eyes, earaches, loss of hearing, tinnitus, sore throat, and fever. So as illustrated, Sanjiao 2. Thank you for your attention. Let's discuss interviewing the vaginal discharge. A light vaginal discharge that is transparent and increases in volume, thickness, and elasticity around ovulation is normal. It is also normal that the discharge increases in puberty and during pregnancy. Vaginal discharge is differentiated according to its color, consistency, and smell. Discharge that is heavier in volume than normal, not odorous and watery, transparent or white, will be a manifestation of kidney yang deficiency or spleen yang deficiency. Kidney yang should control the lower orifices as well as transforming and transporting the fluids in the body. If kidney yang fails to do this, dampness will arise and seep down to the lower jiao. Because the kidneys are not able to control the lower orifices, the dampness will leak out of the body. Spleen yang deficiency can also result in an increased volume of discharge from the vagina because spleen yang is also involved in the transformation and transportation of fluids in the body. Spleen and kidney yang deficiency are often seen together. If there is excess cold or damp cold, the discharge will still be whitish, but it will be thicker in consistency and the discharge will smell slightly of fish. If there is heat present, the discharge will not only be thicker and stickier, but it will also be yellowish and odorous. The more heat that there is, the thicker and more odorous the discharge. The color of the discharge will also be darker. When there is toxic fire, the color of the discharge can become greenish. By vaginal discharge is meant an abnormal discharge and not the normal transparent egg white-like secretion occurring during ovulation. Vaginal discharge must be differentiated according to color, consistency, and smell. An increase in vaginal secretion mid-cycle and during pregnancy is normal. Letter A, color. White, it means cold, or cold can derive from spleen or kidney yang deficiency or exterior cold dampness. Yellow means there is heat, usually damp heat in the lower burner. Greenish means damp heat in the liver channel. Red and white means damp heat. Yellow, red with white pus after menopause is toxic heat. Letter B, consistency. If it is watery, it means cold dampness and or deficiency condition. If it is thick, it could be damp heat and or excess condition. Letter C, smell. Fishy means cold. Leathery means heat. Vaginal discharge observation. Yellowish and odorous discharge means there is damp heat. If it is whitish or transparent discharge, the significance is cold, spleen yang deficiency or kidney yang deficiency. If it is white and red discharge, there could be a damp heat. Greenish discharge could be damp heat in the liver channel or toxic fire. Discharge with watery consistency could be damp, cold, or kidney deficient conditions. If the discharge is with a thick consistency, it could be damp heat. Odorous discharge means there is presence of heat. Thank you for your attention.
Let's talk about Chan, or second interval of the Hanyangning large intestine meridian. Li2 or Chan is on the radial side of the index finger, distal to the metaphalangeal joint. It is the water point, the sedation point, and the yin spring point of the large intestine meridian. Part of the role of the large intestine is to absorb fluids. If this becomes imbalanced, there can be watery diarrhea or constipation. Peristalsis takes sufficient qi and lubrication to occur. Adaptability and a willingness to allow the process of life to occur are necessary to enable transformation. The large intestine is said to propagate the correct way of living, and the will and know-how of water can assist large intestine in this role. Correct implies an ability to live in accord with the nature of the times, and water with its adaptive properties and its ever-forward movement can smooth the passage of large intestine with its proclivity for stuckness and rigidity. As a water and child of metal point on the large intestine, it has a calming effect. It is also cleansing and refreshing, and brings lubrication. This know-how and will of water can help restrain the impulses and desires of metal, to override the instinct to grasp for more of what we believe is needed to satisfy us or shore up our sense of self when experience indicates that it does not. As a yin spring point clears heat from the meridian and organs. They are energetically strong points with great potential. It clears heat from the Li meridian. Interval or space in the name refers to the anatomical location, but the idea of interval reminds one of the connection with the pole and the automated processes of life and how certain aspects of metal need routine to function unobtrusively. Many of these functions we only notice when they go out of balance. Li2 is indicated for cleansing, lubricating, and calming the body, mind, and spirit of the large intestine. It is for constipation from heat in the Li, for arthritis of the fingers, for fever, particularly with abdominal aspect or pain. Large intestine 2 brings the flexibility and fluidity of water to the metal, calms and cools the intestinal spasm or colic, and we consider this for blurred vision or troubles with the inner canthus of the eye. One of the best points on the body for constipation, it is helpful for lack of movement or arthritis in the fingers.
We now talk about differential diagnosis for Parkinson's disease. Western differentiation for Parkinson's disease. Neurological disorder caused by damage to the basal ganglia in the brain, which is involved in movement. Onset usually occurs between the ages of 60 and 70. Signs and symptoms: impaired movement and coordination, muscle rigidity, slumped over posture, tremor can occur at any time to varying degrees, gait changes and shuffling walk, slow movements, muscle aches, expressionless, unblinking face, loss of fine motor skills, decline in intellectual function. Additional symptoms associated with Parkinson's disease are depression, confusion, dementia, oily skin, memory loss, drooling. Secondary Parkinsonism can follow on from stroke, there is weakness or paralysis, numbness and tingling, visual changes, slurred speech, swallowing difficulty, loss of balance, personality changes. It can follow on also from encephalitis, fever, headache, vomiting, light sensitivity, stiff neck and back, confusion, unsteady gait, irritability, meningitis, fever and chills, severe headache, nausea and vomiting, stiff neck, light sensitivity, mental status change. Progressive supranuclear palsy, poor coordination and steady gait, stiffness in neck, arms, trunk, and legs, difficulty swallowing, tremor, slow or stiff movements, pain, visual problems, changes in facial expression, speech difficulty, and dementia. Chinese differentiation for Parkinson's disease. Diagnostic questioning according to Qi, blood and body fluids, primarily aging that results in deficiency of liver and kidney yin, with blood failing to nourish sinews and vessels. Possible yang hyperactivity leads to wind, which can mix with phlegm damp and obstruct channels. Tongue diagnosis. Red and dry would mean yin deficiency. Pale tongue would be qi and blood deficiency. Red with a thick yellow coat is phlegm heat. Etiology: prolonged overwork, excessive sexual activity, poor diet, too much greasy, fried and sweet foods or cold raw foods, emotional stress like anger, frustration, resentment, pre-heaven, gene deficiency, aging, enduring disease. Scalp acupuncture. Body acupuncture and herbal treatment can be supplemented by scalp acupuncture. Needles are subcutaneously inserted into the chorea area of the scalp and low-frequency electricity applied. Zangfu patterns. Liver blood, yin deficiency engendering wind, stagnation of liver qi and blood stasis, qi and blood deficiency with obstruction, deficiency of spleen, lung, liver, kidney, and heart qi, combined with deficiency of liver, heart, and spleen blood. Yin deficiency, liver and kidney yin deficiency. Spleen qi deficiency with damp obstruction, phlegm fire, generating wind. Thank you for your attention.
Let us now talk about auscultation. The topic is voice. In CM, all sounds are produced principally by qi action. The process is not only directly related to the speech organ, but is also closely related to the functional activities of the lung, the heart, the kidney, and other organs. Normal sounds reflect harmony of the viscera and sufficiency of qi and blood. When external pathogenic factors invade or the internal organs lose their harmony, a variety of abnormal sounds may be produced because of the various types of evil qi and pathological changes. Hence, auscultation can not only detect abnormalities of the speech organ, but also the pathological changes in the internal organs and the status of evil qi. Diagnosis by auscultation includes listening for abnormalities in the voice, the respiratory sounds, and the cough. Though the voices of healthy persons may differ in volume, pitch, clarity, and sharpness because of differences in body constitution and emotional state, they all have natural phonation, smooth tone, and clear articulation. Moreover, their speech is coherent. An abnormal voice shows absence of or changes in some of these qualities. Changes in the voice reflect the rise and fall of genuine qi and are related to the nature of the disease-causing factors. In general, a loud and clear voice in a person who is talkative and restless suggests an illness of exogenous heat strength. A soft and weak voice in a person who prefers to talk little or to remain silent suggests an illness of deficiency or of cold. A deep and muffled voice is common in exogenous wind-cold illnesses or blockage by internal accumulation of turbid dampness and is due to the inability of lung qi to ascend properly or to nasal congestion. Hoarseness or loss of the voice may be sudden or gradual. Sudden hoarseness or voice loss is mostly due to an exogenous evil attacking the lung and preventing its qi from rising. Gradual hoarseness or loss is mostly due to internal injury caused by deficiency of lung yin and kidney yin, and consequent failure of body fluids to flow upward. In a patient with a severe chronic illness, sudden hoarseness is a danger sign of impending collapse of visceral qi. Incoherent speech is mainly heard in abnormal states of the mind. Its chief categories are raving, muttering to oneself, delirium, and stammering. Raving is rude, loud, and incoherent speech punctuated by cursing and shouting. It occurs mainly in madness caused by phlegm fire, disturbing the mind, or fire trapped in the liver and the gallbladder. Muttering to oneself typically consists of incomplete sentences, interruptions, and repetitions. It occurs mainly in psychosis caused by deficiency of heart qi so that the heart cannot nourish the spirit. Delirium and stammering both occur mainly when the patient is in a state of mental confusion and are critical signs. Delirious speech is senseless but loud and is accompanied by high fever and mental confusion. It is mainly due to strong heat disturbing the heart and mind. Stammering in this context is weak and confused speech punctuated by interruptions and repetitions. It occurs mainly in illnesses of deficiency in which heart qi is severely damaged so that there is fragmenting of the mind and spirit. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhangfu organ patterns with heart and gallbladder qi deficiency. Heart and gallbladder qi deficiency arises because a person is born with an unstable shen, or the shen has been disturbed and unsettled by a significant shock or prolonged anxiety. The person's mother may have been exposed to shock, excessive sadness, anxiety, or other emotional influences during the pregnancy, and this might have affected the fetal qi. The person may also have grown up in a family or an environment where there has been a lack of love or there has been outright neglect. Severe shock, fright, and fear in adults can spread the heart qi and weaken gallbladder qi. This can be seen in post-traumatic stress syndrome. The unsettled and unstable shen will mean that the person is anxious, skittish, and easily frightened. The weak gallbladder qi will also mean that they are nervous and have difficulty making decisions. When it is congenital, the person will have always been very shy and easily frightened. Now let's go to its etiology. There is powerful shock, anxiety, lack of love in childhood, or congenital characteristic traits. The symptoms and signs: easily startled, nervous, and lacks courage, frequent anxiety attacks, shyness, indecision, palpitations mainly caused by shock, fright, anxiety, and nervousness, wakes up early in the morning, frequent nightmares, waking with anxiety, dream disturbed sleep, spontaneous sweating, fatigue, slight breathlessness, possibly a thin crack on the tip of the tongue, a deep, weak pulse, especially on the left-hand side. His symptoms: nervousness, shyness, lack of determination. Treatment principle: tonify heart and gallbladder qi. The acupuncture points to choose from are bladder 15, bladder 19, ren 15, intang, gallbladder 40, and heart 7. The middle technique is tonifying. To further explain the choice of points, bladder 19 and gallbladder 40 tonify gallbladder qi. Bladder 15 and heart 7 tonify heart qi and calm the shen. Ren 15 and intang calms the shen. Psychotherapy may be relevant since much of the etiology of this pattern lies on the psychoemotional level and probably dates from early childhood. Some clients may feel that they will benefit from healing or similar therapies. It is important that a person with heart and gallbladder qi deficiency avoid shock or stressful situations. Meditation, yoga, and mindfulness will be beneficial. Heart and gallbladder Qi deficiency can be caused by the following patterns of imbalance. So this is more a constitutional pattern, so there will not necessarily be any previous patterns. This pattern can result to the following patterns of imbalance: heart Qi deficiency, heart yin deficiency. Thank you for your attention.
Inspection, mental status. The method of inspection applies visual observations of the exterior of the body in order to deduce the state of the patient's health and illness. It focuses mainly on observation of the patient's mental status, coloring of the complexion and skin, general appearance, and the tongue. Mental status is the external manifestation of the state of the vital processes of the entire body. It includes the patient's vitality, consciousness, and thinking process. The mental activities are generated by the physiological activities of the visceral organs and are dependent upon the material basis of qi, blood, and body fluids. If the visceral functions are normal and qi and blood are ample, then the mind is vigorous. Conversely, if the visceral functions are abnormal and qi and blood are inadequate, then the mental status is abnormal. Thus, the normality and vigor of the mind is an important indication of body health. Mental status is reflected in the eyes, complexion, posture, speech, and level of consciousness. But because of the most intimate relationship between the eyes and the visceral organs, the most important aspect of assessing mental status is the observation of eyes. Mental status is generally classified as vigorous, lethargic, or pseudo-vigorous. Vigorous mental status. Vigor reflects ample vitality, qi, and essence. It is seen as bright and lively eyes, a radiant complexion, natural and relaxed expressions and posture, alertness, smooth movements, clear and coherent speech, and mental clarity. Vigorous mental status indicates that essential qi is ample, the constitution is strong, and vitality is full. Even when the person is ill, it indicates that essence and qi have not been damaged, the visceral organs have not been injured, and the prognosis is excellent. Lethargic mental status. Lethargy is a sign of exhaustion of essence and deficiency of qi. There are a variety of characteristic symptoms, such as dull eyes, slow and awkward movement, blurred vision, dull complexion, and facial expression, heaviness of the body, and sluggish responses. In severe cases, there may be confusion, delirium, or hallucinations. Lethargic mental status indicates that genuine qi has been damaged so that essence and qi are both depleted and all functional activities are depressed. Clinically, it is a sign that the illness is grave and the prognosis unfavorable. Pseudo-vigorous mental status. This is a false and transitory improvement in mental status when the illness is critical. It is often seen when death is imminent in a patient who has been seriously or chronically ill with exhaustion of essence and qi. The patient suddenly shows mental alertness, bright eyes, clarity of thought, though often restless or agitated, desire to sit up, talkativeness, though often with simple and repetitious content, a louder voice, flushed cheeks, and appetite. Pseudo-vigor is thus an abnormal sign in a patient whose visual essence and qi are on the verge of collapse and the vestigial yang is about to disperse. It must be distinguished from real improvement in the illness. In general, pseudo-vigor comes abruptly and is transitory. Its features do not match the patient's general condition. The ancients compared it to the flash of brightness of a lamp just before it died from exhaustion of the fuel. Thank you very much for your attention.
Let us now talk about epigastric pain. The topic is retention of food. The clinical manifestations of retention of food are dull epigastric pain, which is worse with pressure, feeling of distension and fullness, belching, sour regurgitation, foul breath, vomiting of undigested food, epigastric pain relieved after vomiting, loose stools, or constipation. The tongue will have a thick, sticky coating in the center and root, which could be white or yellow, and the pulse will be slippery. This condition is very simply due to accumulation of undigested food in the stomach. This can result either from overeating or from deficient stomach chi being unable to make food descend. The accumulation of undigested food in the stomach causes the dull pain and characteristic feeling of distension and fullness. Undigested food obstructs the stomach and prevents stomach chi from descending. This causes belching, sour regurgitation, nausea, and vomiting. The fact that vomiting relieves the pain indicates that the obstruction in the stomach is of a substantial nature, that is, accumulated undigested food. When the obstruction is of a non-substantial nature, such as stagnation of chi, then the pain is not relieved by vomiting. Whether there is constipation or loose stools depends on the relative strength of spleen and stomach. If the spleen is deficient, the accumulated food in the stomach prevents the spleen from transforming food essences properly, and this results in loose stools. If spleen chi is relatively strong, then constipation may result from stomach chi not descending and not moving the digestate downwards towards the intestines. The thick and sticky tongue coating in the center and root reflects the accumulation of undigested food in the stomach and intestines. It will be white if there is cold and yellow if there is heat. The slippery pulse reflects the accumulation of undigested food in the stomach. This pattern as a cause of epigastric pain is more common in children. The treatment principle is to dissolve accumulation, eliminate stagnation, and restore the descending of stomach chi. The acupuncture points to be used are Ren 13, Ren 10, stomach 21, stomach 20, stomach 44, stomach 45, spleen 4, pericardium 6, stomach 25, and using the reducing or even method. The explanation for the acupuncture points used is Ren 13 subdues rebellious chi and relieves belching, sour regurgitation, nausea, and vomiting. Ren 10 stimulates the descending of stomach chi. Stomach 21 is suitable for excess patterns of the stomach and it stops pain. Stomach 21 dissolves food accumulation and relieves fullness. Its name, Chengman, means bearing fullness. Stomach 44 and stomach 45 are distal points suitable for excess patterns of the stomach. They both stop epigastric pain. And stomach 44 clears heat and stomach 45 dissolves accumulation of food. In particular, stomach 45 relieves insomnia caused by retention of food. Spleen 4 and pericardium 6 in combination open the penetrating vessel. This is especially indicated in excess patterns of the stomach with obstructions in the epigastrium, a rebellious stomach chi, and resulting feeling of distension and fullness. And stomach 25 is the front collecting point of the large intestine. It resolves retention of food by promoting the bowel movements. For dietary advice, the patient should simply eat less and more slowly. Thank you so much for your attention.